Welcome to Healthcare Champions. I'm Shelley Sanders, and today we're talking all about the ears, nose, and throat. I can't think of a better person to talk to you about that than Dr. Scott Powell with Florida ENT and Allergy. Welcome to the show.
Thank you for having me.
So, okay, ears, nose, and throat. We live in Florida. I don't know one person that doesn't suffer from some type of allergies at least one time a year, and that is pretty much all year.
That is true. Our allergies never stop, and we never get a freeze. And so without that, all the allergies just mismatch.
So you're a busy man.
Indeed.
So that being said, where are you located?
We have 13 offices around the Bay Area, so Pasco, Hillsborough, and Pinellas, with 25 physicians. So we pretty much have the whole area covered.
Sure. So if you're watching the show and you suffer from allergies, well, then you're going to want to pay attention. And there's obviously an office somewhere near you with 13 locations near them so they can check it out.
That's right.
All right, let's just get down to it. I mentioned allergies. I mean, it's in the name of your clinic, Florida ENT and Allergy. Let's talk about them, allergies. How do you know it's allergies and not a cold, or vice versa? You know, there have been times where I've thought, like, oh, I think I must just having a cold. Turns out it's an allergy. How do you know the difference?
Well, the key with it going to be is the cold is going to be much more condensed. You're going to have the peak and it's going to go away, and you tend to have other symptoms. It won't just be the nose or the throat. You can have some other aches and pains that go along with it. The thing with allergies primarily is it'll just blow right past the cold time period, which is roughly up to 5 days, we'll call it. So at the allergy season, it just keeps on going, and then the symptoms are not what I describe as the TV version of allergies, the sniffling, sneezing, running, you know, the NyQuil version. It is more of just constant congestion. They forgot what it was like to be normal.
Sure, it really creating that fuzzy, foggy feeling, or even sometimes painful and uncomfortable.
Right.
To the point of missing work.
Missing work, feeling fatigue, mental issues of confusion, then it can even progress into sinus infections. It can affect their voice. It can really own their life.
Sure. Well, that was my next question. Is it a situation where left untreated, allergy symptoms can turn into something more than just allergies, and now you're dealing with multiple issues?
Right. It definitely can be the feeder to the fire, I call it, when the sinus infections come along, and it just keeps on going and going. And the problem now is there's so many medicines over the counter, no one really knows what they're overwhelmed by that shelf. And so they decide which pill to take, which spray to take, and they can go the wrong direction and suffer.
Okay, so the bottom line message there is don't self-diagnose.
That's right.
If you suspect, come see you, correct?
Come on in, we can see what the problem is, see if it truly is just the allergies, and go from there, even evaluate with allergy testing and determine what they're exactly allergic to.
You bring up a good point with that, because I'm thinking like it could be something where you maybe are getting some relief from this shelf at the drugstore. Okay, this is giving me some relief. It's not dead on, but it could be something as simple. You actually have an allergy to one specific thing where by eliminating that, you don't even have to take this medication for 6 months or however long that you have this allergy, correct?
Right. Correct. And it could be a specific thing or a specific season that we can take up the medication and then come back off the medications, or they have an anatomical blockage in their nose, deviated septum, that you fix that, their world changes forever. They've been struggling to get above that. So there's a lot of different things that we can help guide the right path and decide which way to go.
Wow, that's got to be a pretty liberating feeling from a patient standpoint, like, oh my gosh, why didn't I come to you sooner?
It's a pretty impressive aha moment, and they enjoy it.
Wow. Now, what is involved in diagnosing these things?
Well, a lot of it is examination. So in the examination in the office, we can go and look and determine if it is truly just an allergic issue. And luckily in the house, we can also go one step further if need be. We can do allergy testing. What that entails primarily is skin testing. And there's the environmental side and there's the food side, which is a whole untapped resource in terms of problems.
Sure. Now, all that's done in the office?
Correct. All in the office, so we get the answer right then.
That's so nice. It's very refreshing. I'm certainly sure for patients that maybe are transportation challenged, or even those that have taken off work to come and see you, and now they know, oh, I don't have to go to another doctor. You do all that in-house.
Yeah, keeping under one roof, it really does help their quality of life, because they have other things to do. They have to work, they have kids, they have stuff. And so if we get everything done right then, they can leave the office with a plan and go forward.
Sure. Now, going forward, let's say with the treatment, is the treatment for allergies versus cold different?
So cold is really just symptom relief. So over-the-counter sprays, you can have some decongestants and so forth, but for the most part, it'll run its course. Allergy-wise, there are medications, a lot over the counter now, but if it's severe or uncontrolled, we can go on to what's called immunotherapy, allergy shots, allergy drops. There's allergy toothpaste now to really desensitize them to what's the problem.
Gotcha. So it's really unique to what the patient's allergy is, but with a cold, generally speaking, let it run its course.
Yeah, just deal with the symptoms and let it go.
All right, for all these allergy sufferers that are out there right now thinking to themselves, oh my gosh, Dr. Powell, how do I get in touch with you? How do they do that?
Probably the easiest way is their website, floridaentandallergy.com, and then from there they can evaluate all our options as well as our phone numbers.
Perfect.